Hi everybody, Patty Hayes here. Thanks for watching this video. We're going to talk about foundational public health services, and I've got visuals for you today. So, as we all know, public health has experienced cuts over the last number of years, and that they've been problematic, and actually they've been statewide. The cuts are only made worse by growing population and by siloed funding here. So what we've experienced as our population has gone up is our funding has actually been going down. And I've been talking a lot to the council about that. And at the same time, as we have more and more grants that we're having to work with and count on for our basic work here, grants put us into silos so that we're not able to have the flexible money that we need. So this is the basic for our challenge that I've been addressing. And I must say that I've always said that we need more than one funding source new for public health in these days. And so I'm very happy that last year the voters approved Best Starts for Kids that stabilized our maternal child health services. And that Community Health Service Division has gotten those monies this year for that footprint. So what I'm going to talk to you today about is the next phase of a new funding source. So that's why all the local health jurisdictions across the state have been working together to take a look at what do we need to do. So I've been working on the statewide steering committee, and the goal of this work is to have a core set of public health services available to everybody around the state so that all public health would get an infusion of dollars. What we're asking for is $7 million per year for public health here in King County. So the overall state budget ask will be for all of the state, but our piece of that would be $7 million. So what is that about, and how do we take a look at it? We know that everything we do is important to keep the people in King County both safe and healthy, all the work we do. But for this first infusion of dollars, what we had to look at is what was both visible to the public, what was compelling. There were a series of focus groups that were held across the state talking to the public about what did they know about public health and what really resonated for them in terms of the importance of our role. And then we know here in King County particularly that there are some real issues that are visible to the public. So you may have seen over the last number of months that our outbreaks are at a new level. Both Jeff Duchin and I, in our more than 25 years of working in public health, have not seen the number of outbreaks that we've had over the last couple of months. For example, we had over 225 travelers monitored a couple of years ago for Ebola. Syphilis is up 153% in King County. There's a lot of people, as I've been talking to elected officials, that thought syphilis went away. Not true. We've had over 575 individuals tested for Zika here. Now, not everybody has Zika, but we have had to have the staff testing for that. We've had 121 screened for TB. And as part of that, one of the most compelling things as I've been talking to local public health officials is one of the pieces of work that we have stopped over the last number of years is monitoring and helping the 100,000 people that have latent TB. In other words, TB that's not active. It's not infectious yet. We know that 10% of those people are going to convert to active TB, and we haven't had the staffing and infrastructure to help those folks. That's very compelling to legislators. And then you probably saw the report of Legionella outbreak at the Seattle hospitals. So with this, what we've developed is a focus that will be about our communicable disease control and the preparedness piece of this, which is a cross-cutting service, and the communications need, because we know we need to work with all of our communities. So this is a cross-agency first infusion of dollars that involves our communicable disease as well as some in the chronic disease injury prevention section. But really, when we heard from the public, this really resonated because of all the headlines they've been seeing. So this first dollar infusion or down payment, that's how I want you to think about it. We're going at this with the legislature over the long term because not only do we need to address this, we need to modernize the system. We need to make sure that as we're working in public health around the state, we're doing it most effective and efficient way. And for a lot of the smaller jurisdictions, that's going to mean working together in a different way. And for us, it's a recognition of the great work that you do that actually influences all the work that's done across the state. So this is a multi-year process. With this year, we're asking for that down payment, which would give Public Health Seattle King County $7 million. I keep saying $7 million because I'm really focusing on that and trying to get that for us. So what happens next? So the governor proposes his budget. That's going to come out around December 20th. Then all of public health is going to be educating the legislature and working during the legislative session. I'll be going down to testify with public health about the critical work that we do and what we would use the money for. And then the legislature will have their budget process that may go well into June, hopefully not any longer than June 30th, to decide. As part of this, Public Health has set up a website. So what can you do? I want you to be fully informed. I'll be doing that in my messages to you every month, but here is a website you can go to, publichealthisessential.org. There's going to be all sorts of information and updates listed on that, or you could follow us at Public Health is Essential. So by keeping yourself informed, I know that all of you work with organizations that if they knew the crisis we were in, would really care about that. So I challenge each of us, for those organizations or our churches or other groups we're involved with, to talk it up, get them to come to the website, get them to follow us and learn more about the critical work you do and the core work we're trying to fund. We're going to have a presence at the Washington State Public Health Association Education Day, which is March 1st. But beyond that, you have the ability to talk to your neighbors and individuals who can be our voice to legislators. So talk it up, talk your work up, tell your stories, and make sure that your neighbors, your churches, your organizations are all realizing that public health is a must. There's going to be a lot of interest over the next year on solving the gap. It's called the McCleary decision for funding of basic education. But you know what I've been saying to our elected officials? It's great to fund basic education, but if children are not healthy, they won't succeed in school. And so we are a critical part of the funding to make sure McCleary works. So be sure and tell folks that. So that's my story today. Thanks for watching. Keep informed, and I really appreciate everything you do every day. You make life better for the people in King County every day. Thanks.